Hi, Ger, and good afternoon to everybody. It's Patrick's Day, St. Patrick's Day 2021, and it's 2 o'clock in the afternoon. We can't go outside and celebrate like we did normally. Even this time last year, Ger, what were you doing this time last year?
Yeah, John, this time last year, firstly, happy Paddy's Day to everybody. Another very different Paddy's Day. As you said this time last year, I was in Croke Park. So firstly, it's apparently one of the, not a regular sight to see a fella from Cork and Croke Park to start with. But certainly on Paddy's Day. And it was for the start of the drive-through COVID test centres. Which was, it made big news at the time. Armageddon was coming and it really looked like something from a movie. I still remember the day quite vividly with reporters standing up on ladders and everything trying to get a little snapshot in. But just the way things have progressed now, 12 months on, we're still in a lockdown. And the only difference now is that all this testing and all of it, it's the new norm. And it's, people have gotten used to it now compared to what it was this time 12 months ago. So I suppose hopefully things can only get better now.
Yeah, and we Irish, we have something else to talk about other than the weather. And we have all these new phrases, hour numbers and lockdowns and restrictions and all a whole new language now that we've learned in the last 12 months. Well, look, I'm going to take this off because we want to get into some serious work. We put out questions to the community first responders around the country, and we asked them to ask anything about CFR activity, anything from forming a new group to recertifying, training, PPE, anything, any questions they had, and we asked them to come back with us. And I have a list of questions here. It's quite long for you, and hopefully you're going to give us some answers. I'll give those people some answers who the groups who asked the questions. And I'm going to kick off with Dunmanway. Dunmanway CFRs, and they say we were a group that were just in the process of setting up at the time CFRs were stood down. When do you think our group can start the process of commencing training and continue on to going live?
I suppose, John, the way things are now, even our long-standing CFR groups are almost starting from scratch again in terms of training and again that phrase, the new norm, which for CFRs now is the use of PPE, like the ambulance crews. So there's no reason at all why new groups who we'd say would have been almost live with us just before COVID can't re-engage with us, with the local community engagement officer, and start learning about their PPE and all that they need to do. There's still all that other online stuff. There's the Garda vetting, Children First. It's quite heavy at the moment with online courses, but it's the new norm. Everything is online. I mean, normally we would have planned to maybe have this chat face to face, like a fireside chat. I said, and here I am in Rivers Building in Tala on St. Patrick's Day, and you're down in what's that place again, John?
That's Dunlavin.
But look, that's just the way things have gone now. But certainly for any of those groups, and for even any groups who were only beginning their journey really to becoming a group, there's no reason why they still can't start to re-engage with us. And we'd certainly start to get PP out to them and start building the training from that then.
Okay, the next question I have is from Kilbay CFRs. It's actually 2 questions, so I'll give you the 2. I need a recertification before the 1st of July. How can I obtain this? Can the course be done online, or could it be extended until I receive retraining? And the second question is, will CFRs be offered vaccinations prior to reactivation?
Okay, then. So I suppose the first question there in regards to training, there's 2 things at play there. So is it just the CFR certificates that are out, or is it that it's the instructor's certificate that's nearly out?
Yeah.
But either way, both of those questions can be dealt with nice and handy with the local CEO above. We have arrangements in place with the Irish Heart Foundation in order to recertify people. I suppose it is important to say that at this point, extensions really aren't going to be a thing. And I think anybody who is serious about CFR will know it's not really about the cert. Yes, you do have to have it, but it's the practice and the training that's important.
Exactly. Yeah.
And I think at this point, nearly all groups need to retrain. I'm not saying recertify, but I think it would be a good idea for all of the groups that haven't been training to actually just go through the whole course again, and pick it up from there. So I suppose, look, for that group, I'm not familiar with their setup or, about their certificates or their training or any of that. So the person to answer that is their local CEO.
Contact your CEO. Yeah, absolutely. And the second question on vaccines, I've just give it to you again there. Will CFRs be offered vaccinations prior to reactivation?
Okay, so no is the straight up answer, John. There's a lot of things at play. When it comes to the vaccinations, it's been rolled out to frontline healthcare workers at the moment. There's a scheduling there for it. We don't manage that scheduling, okay? And I suppose while we absolutely value everything that the CFRs do, and back during the last virtual respond, you would have heard the director also commending CFRs, in the way that they were stood down and like a coiled spring, they were back up again themselves, doing other community duties. But just for the moment, we are doing our best to advocate for CFRs, but it is just for frontline healthcare workers at the moment. I suppose, look, to be quite blunt as well about it, because it's important to say that this document exists, which is the opting in document that we developed in order to bring groups back online. And that clearly states that, anybody coming back is doing so, knowing the risks involved. They're going to make an informed decision as to whether they want to come back as CFRs. There is no mention of the vaccine in that. And unfortunately, that's just the way it is. While, again, we absolutely value everything that our members are doing, or I suppose, the group's members, because that's where there's a little bit of, sometimes a little bit of misunderstanding. So CFR groups are all standalone community groups, but they're linked to the National Ambulance Service. So they're not actually directly volunteering, within the ambulance service as a whole. It's different to how we would see the Garda Reserves and how we would see the Reserve Defence Forces. They're directly volunteering to the organisation, whereas CFR, the way it was set up back in the day and remains at the moment, is that they're standalone groups who are linked to the National Ambulance Service. So unfortunately, in terms of the vaccine, for now, it is a no, but we will continue to make representation for everybody.
Yeah, I know we CFR Ireland, that is, we made representations to yourselves as well back in December, and just on this very subject, because we knew they were coming, and that's when the immunisation advisory committee was being set up, and we were hoping that you would forward that to that. I'm sure that's where it landed, but I understand where it is, and I understand even this week with the short supply of vaccines coming in, it's not an easy thing, and of course everybody's worried and everybody's trying to get the vaccine. Everyone wants to go back on call and all these things, but it's what you say. You CFRs really need to think long and hard before they put themselves out there for reactivation, and to do so knowingly, I think. Okay, all right. So look, we move on. Now a question from the real capital. So it must be from Dunlavin. Oh no, it's not. It's Carricktool. As most instructors are now out of certification due to pandemic and no training is taking place, what would be the process of recertifying the instructors, and will PPE instructor training be part of it?
Okay, so that nearly ties into an earlier question again, but just to answer quickly, yes, for our instructors that are affiliated to the training sites associated to the ambulance service and the Irish Heart Foundation, we certainly will be working to bring those instructors back into certification. Again, we are working closely with the Irish Heart Foundation to do that. And it's your local CEO again. Now, I know Carrick Toole is in Cork and in the south, so it would be myself. I can make contact with them. But no, certainly nobody's going to be, left in the lurch really, as a result of the pandemic. Now, as for PPE training, so initially, if you remember when we first rolled it out, we initially came out, we taught it after the group members had watched it online, and then we came back a time later to do an assessment. But what we learned, and again, this is all a trial, what we learned from it is that when we actually went out to teach it, that the members were absolutely way ahead, and we could have signed them off pretty much there and then. But we had to stick to the protocol and procedures that we put in place at the start. And until we were able to go back and present our case to the HPSC, we were then able to take away the need for us to go out and teach it. So now members will get their delivery PPE, they'll watch the videos at home and practice and learn, and then we'll come out and we'll assess it. I do imagine as the network starts to grow, which it is quite quickly at the moment, groups are coming back and are starting to stand back up again. There will be a need, for the assessments to take place at a more local level. So we will look at that. And we had been, prior to COVID kicking in again, been looking at coordinators type of a course, for want of a better word for it to call it. And in that, we're now going to add in like a COVID compliance segment to it. And hopefully we'll be able to then, as part of that, it'll be we'd say the coordinators or designate other as such could potentially be the person signing their group members off going forward.
That's the plan, or you're looking at that at least. Okay.
Yeah.
Okay. Now I have a question now from Ballyconnell, Coolkenno, and it's a related one again. Once groups are now up and running, when will we be able to start retraining new recruits?
Yeah, look, it ties in with other questions there. I just going to show everybody's probably thinking the same thing out there, and it's great to see that. But there's absolutely no issue with bringing new recruits in now. They still have a little bit of a journey to go, in terms of their online courses, their Garda vetting and all that would normally have gone with volunteering. But again, when it comes back to training, I think it's that the whole network needs to retrain now. With white groups that had been stood down. So it's possibly no different at all for a new person coming in, really. I suppose the only big difference is that our longer standing groups would have the experience in terms of responding to a call and how to deal with the ambulance service at scene and all of those kind of things that you can only learn with experience, the trade craft, you could call it. But no, long-winded answer to that, and that's bring in new members, get them trained, make sure they're up to date with PPE, and there's no reason at all why you can't do that.
Should we wait till the COVID restrictions are lessened to somewhat, or could it start now?
I suppose, yeah. Look, you could start sending out the online courses to them anyway. So we know from experience now that this does take time. By the time people do their online stuff and do their PPE training and wait for Garda vetting to come back and all of that, and hopefully by the time that happens, the restrictions will be lessened. But nevertheless, it's essential training. Okay, it's essential pre-hospital training to maintain the group. So I mean, there is no issue with it if needs be. But if you can kind of restrict the numbers, especially at training, it's important. It is important. And And, you know, like granted the hall might be huge, but you'd still want to follow our guidelines from the training doctor and keep the numbers low, even if it means doing 2 training sessions in one night, or, you know, 2 a week, or whatever the case may be, because people do still tend to congregate and have the little chat and just forget for a minute, you know. So let's keep the numbers low for now anyway, you know.
I suppose we say it again, and we're going to keep on saying it, contact your CEO before you commence that process. Would that be fair?
Yeah, absolutely. Yeah. Absolutely.
Yeah. Okay. Another question from Cork, Passage West, Monkstown. And I know you said earlier that there's 30 groups up and running already, but here's a question from Passage West, Monkstown. Realistically, when can we expect a startup for the main bulk of responder groups across the country?
Okay, so I again, that ties in with other questions there. I mean, our groups are back up and running since December. There is not going to be a bulk standing up of anybody. It's going to continue to be controlled and safe. There will be no blanket standing up of just all the groups again. But you know, Passage West, my grandmother is from there. I know it well. And again, they can reach out to me and we can start the ball rolling with their PP training. You know, I suppose just to throw this in here now as well, there has been engagement from myself with the groups in the south via email, but understandably, sometimes email threads get muddled up. But hopefully, like Passage West, to answer your question, I know I did send an email to the Passage West group, so by all means, come back to me and we get the ball rolling.
Perfect. Okay, moving across the south now to Wexford. It's a new group, or a group in the process of starting up, and this is the question from David, the chairperson. I'm in the process of starting up a CFR group in Kilroon. I hope Bridget won't kill me for that now. In Wexford, we have volunteers signed up, and we're trying to get some funds together. Is there any government funds or grants to help us for a defibrillator, first aid bag, etc.? That's thanks, Dave, from the Glen Kilroon Community First Responders. I might have a comment on that, if that's okay with you, Ger.
Yeah.
The short answer is that there's no direct funding for AEDs. However, at this time of year, county councils are very open for grant aid, and so you just need to make an application. Unfortunately, it'll all depend on what stage of setup you are, because if you're not reasonably advanced, they're not going to give over funds to a group that's not kind of set up or registered with somebody. So it can be tricky at this stage. However, I'd say well done for getting your group off the ground, and keep at that process. Contact your CEOs and then start the online bit and all the other training that you need to do. We have found over the years, and over many years of setting up groups, fundraising is never an issue, and buying equipment and defibs. The funds seem to come once you start acting in your community. So it's never going to be deterrent. What is your biggest problem is going to be training getting responders, training them and keeping them. So that's where I'd be concentrating at this stage, and not be too worried about the funds.
Yeah, I'd have to agree with you there, John. Yeah, I suppose, look, the fundraising and all that always rests with the groups, but certainly building the numbers and starting to get a little bit of public awareness out there, and the fact that the CFR network is so close anyway, and I've seen this myself as my time as the CEO for North Leinster, where a neighbouring group will go and train the new group. There should be absolutely no cost for training. Nobody should have to pay a cent for training. No. And that needs to be well known, because I did actually hear some horror stories in my travels where people were actually paying huge amounts of money to get their groups trained and certified and all of that. And that's definitely not going to be happening going forward. We want to make sure that the groups support each other. And in terms of equipment, I know, again, I've heard you saying this before as well, John, about where a neighbouring group will give a lend of a defib, to the new group, just to help them until they get going. And it's once they build up their public image then in their town or village or wherever they are, they start to become known, and that's when the local businessman will say, oh, you know, we give you a few bob, or we'll host something for you, or, you know, something like that.
Exactly.
Yeah.
That's exactly what happens. That's exactly usually what happens. Our individuals come forward in the communities as well, and fundraising is never an issue. And also, just you said about the networking there, local groups. If you contact your local CFR Ireland rep, and he can put you in contact, he or she can put you in contact with the local groups as well, because they'll always have their finger on the pulse of what money is storing, handy money, if you want to call it that, in the county councils or wherever, something that they can apply for. Just to roll back though, at this level of your launch, it can be tricky because you're not an organised organisation, so it can be tricky to apply for some funding, because they need you to be registered with a couple of other bits and pieces as well. So it can be tricky. But please contact us or contact CEOs, and we'll give you whatever direction you need. Okay, we'll move on. Yeah, here we go. I have a couple of questions from Selbridge CFRs up in Kildare. What time scale are you working towards getting CFRs recognised as frontline healthcare workers and receiving the vaccine in the COVID-19 vaccination rollout? We're responding alongside our colleagues from the National Ambulance Service to possible COVID-19 positive patients, and this has not been recognised by the National Ambulance Service yet.
Okay, I suppose again, it's just I'm going to just end up repeating myself with a previous thing, but we're in no position at the moment to recognise a CFR volunteer as a healthcare worker. Okay, so again, each CFR group are standalone, and they're linked to the National Ambulance Service, you know, to get, we say, the insurance indemnity covers and things like that, and obviously to get the, you know, the alert text from NEOC and so on and so forth. But again, I can only say that again that we really appreciate everything that the groups are doing, and we will continue to work with them. But we certainly recognise, the fact that they're working alongside NAS colleagues. But I suppose again, to point out, our NAS, your NAS colleagues are at a much higher risk than anybody else in this field for contracting COVID or needing protection against COVID. They're with patients for a long period of time and multiple patients throughout their shifts. So that's why it's so important that all NAS staff were vaccinated in the early phases of all of this, because I suppose, you know, you're at an obvious greater risk when you're dealing with a patient for a prolonged period of time and multiple patients throughout your shift. It's not just a case where it's one call a month or two calls a month. This is the job they do every day, and you know, it does put them at a greater risk. And in terms of risk, they're way up here compared to others.
Yeah. Okay. Like I said, we had a similar question before. Okay. Here's the next one for you, Ger. Are there any plans to get a national uniform for CFRs?
Okay, so again, the national uniform is something we've been talking about for a long time. You know, and it would be nice to have it uniformed around the country. But in saying that as well, it's lovely to see all the different groups with their own logos and their own designs and colours and motifs and all of that. At the moment, there won't be a uniform. Okay, there's not going to be an actual uniform, and I know, again, we watch what happens across the water, and the CFRs over there would generally have a nice NHS T-shirt with a logo on it and all of that. What we are working towards at the minute is a branding for the Community Engagement Office, so that will be the basis of it. And once we have that in place, I would hope then that we would be able to get that branding out to CFRs as well. So you would continue to have your own flag but just to have something to say that you're linked to ours as well. So it is in the process. The national office is brand new, as I said earlier. So there's a number of priorities that need to be sorted. It's not exactly high on the priority list, but it is being worked on in the background. So hopefully there'll be something.
Okay. This one I think is for me, Ger. How can I become a CFR Ireland regional rep? It's actually quite simple, really. We have Ireland is divided into 3 areas. The national for CFR Ireland, the same areas as the National Armed Service. We have the West, the South, and North Leinster, and we have 3 reps within each area, and so that's 9 in total on the committee. And every 3 years, their term of office is 3 years, and every 3 years there's an election. We just had one actually last before Christmas, and we elected new representatives in each of those areas. We do still have a vacancy, however, in the West. We only have 2 reps in the West at the moment. So if you are in the West, this questionnaire, I don't know what group it's from, but there is a vacancy in the West at the moment. But that's how you become a regional rep. You're voted in by your peers, by your groups, and that's how. That's the way the CFR. I'll just actually expand that a little bit. The CFR Ireland committee is made up of the directors, which is David Menzies, medical director, Ciara Downing is the vice chair, and Roisin Dempsey is the secretary, and myself, we're the 4 directors. And then we have other members as well on the board. We have a total of 16 people on the committee, and 9 of which are elected onto the committee by the CFR groups. And that's how we get the national representation onto the CFR Ireland. It's as simple as that. Okay. Oh, here's a technical one for you, Ger. We have heard that NEOC, that's the National Emergency Operation Control, plans to move away from sending text messages to CFR group phones, and instead will send it to phones of active members in the group. Is it something is planned to happen in the near future?
Okay, at the rate that information seems to bounce around the CFR network, I'm not sure we'll need text messaging much longer. But we have just rolled out yet again another trial. This time it's of a technical nature. At the start of the month, we did implement individual texting for some of the groups just to trial it, basically. The way it will work is that each member of the group will be put up onto the CAD system. When a cardiac arrest or appropriate call comes in, each member of the group will receive the alert text. I suppose the downside to that for people is that it's going to be up to you, the individual member, to control the alerting yourself, in the sense that you're off on a Saturday night, you don't want to see a text come in, it's going to be up to you to mute it. But that's about the only downside I can see. And now we look at all the pros. All right, normally people tell you the pros first and then give you the downside, but that's about the only downside, and to me that's not even a downside, because if I was off call on a Saturday night, I decided to pop down to the local shop and there happened to be a cardiac arrest in the chipper next door. Well, if I was after taking myself off call at a group level, I'd know nothing about it, possibly. Okay, but I'm getting the text now. I'm not supposed to be on, but I'm still getting the text, and I just happen to be in the right place at the right time. And now all of a sudden there's hands on chest within a minute or two, because each member will be carrying their PP in their car. So like that's even though it's a little bit of a con for some people, it still has a big pro to it. So then what will happen is any member of the group can text back. Now we'll be recommending and actually asking that all the members that are responding to the call text back. Now you can probably relate to this yourself, John, even just from hearing stories over the years, and I'm not picking on any particular area, but Wicklow in particular, I suppose due to the geographical nature of the area, mobile phone coverage can be dodgy down there. All right, and so now instead of relying on one or maybe two phones receiving the text, now you could have 6, 8, or 12 receiving the text.
Yes.
When it comes to responding back to going mobile on the call, then let's say 4 members are responding, because remember, we don't want a Patrick's Day parade down to somebody's house, with people out in the road waving ambulances down, and all of that kind of stuff. Those days are gone. All right, it was something we were trying to maybe phase out anyway, but certainly with COVID, they're gone. So when they text back, whichever text hits the NEOC computer first will register the group, not the individual, but the group as mobile to the call. So let's say, John, you send the mobile, you all send it, but yours hits the system first because you were the only one out of 4 people who had signal, okay, at that time, all right, when they went to send it back. But Mary in the group lives next door to the patient, and she gets there first. When she puts her 04 for that scene, it's her text that registers on the system, but registers the group. So it gives a good true value to response times for yourselves and things like that. It also gives value for us because you'd see the director's report where it says how many community engagements there are, CFR engagements. And that's only based on a report from the CAD because we have no other way of getting it. Now, I suppose for those, the CAD is the computer-aided dispatch system. And that gives us every bit of information that we need. And it just means that you'll start to see the more groups that go back and the more groups that text back, the numbers of CFR engagements are going to start rising, because what we found, let's say prior to COVID, groups weren't texting back, and then in some cases groups were texting back, but there was an issue of a technical nature on our side. And it just meant that on average, it was kind of saying that of the 275 groups, they were only doing 1.5 calls a month each, or something along those lines, right? Wow. So your face says it all, but it's down to the texting, and unless you text back from a safety perspective now, especially, we don't know you're going. If there's any safety issue at scene, we won't know you're going to stand you down. And also, getting back to COVID, if there's any major COVID concern after the call, well, at least we'll know to contact the CFRs as well. All right, so that's how it's going to work. So basically, everybody gets a text, anybody can text back, and it's the first text that hits the system registers. That's it. Yeah. But look, it's
interesting. It's interesting what you're saying. Sorry, it's interesting what you're saying there about being next door. For instance, if you weren't on call and you just happen to be around during the day, you're cutting the grass or painting the wall or whatever you're doing, but not necessarily on call. That's the system we were using, and it could be just next door, and you're available to go. You're there very quickly. It could lessen those response time if you just look at your text and say, "Wow, it's just next door. I can go." That's very interesting. It'll be very interesting to see the results now in a few months' time or a year's time when we get a chance to look at some figures. It'll be very interesting to see.
Yeah, and just on that right place, right time thing. There's probably some groups listening to me now saying, "But we're on call all the time." That's fine, but there's so many different dynamics out there as the whole groups have been managing. So you have the different forwarding apps. You have an actual dedicated dispatcher in a group who carries the phone, and when the text comes in, they dispatch the CFRs within their group. So like what you might think is strange for me to be saying about how things might change, it could make things totally different for other groups, So there's just so many different dynamics out there. There's no group really the same as the other. Yeah. There's always a slight difference,
Yeah. Okay, this is another technical one. There was talk of the National Ambulance Service moving away from the current model of CFR group area covered measured by circular radius from a particular point and move towards a polygon border approach to ensure less gaps between neighbouring groups. When and how will groups transition into this? I thought we had polygons for a number of years.
Yeah, he did. Yeah. So that, yeah, polygons. Just to explain for people, are just lines drawn on a map as such. So we can draw lines on the dispatch systems map, and you'll only get calls within that. Now they're always done on a case by case basis because it's not always necessary. But if you were to take somebody living somewhere where there's an estuary up a river, it's probably one of the best examples. So we'd say in the south you would actually have Passage West CFR on one side of the mouth of the harbour, and then you have the channel up, and then you have Cove CFR on the other side. And what happens then is sometimes the one group are getting the text for the group across the water and vice versa, with no expectation of ever getting to it. You know, so in that instance, what we would do is we would draw lines on the map, and we draw the line down the coast on both sides, and then they wouldn't get calls over. But again, it is a case by case basis really, because it is a lot of extra work for ICT. You know, they make all the magic happen in the background. We always mention the unsung heroes as being our dispatchers and call takers, which absolutely, yes, they are. But we have the background people as well. So you have our informatics team, and they're the ones that are constantly upgrading the systems, and they're the ones that this new text system is also accredited to. So, you know, we don't want to overburden the meter. The radiuses, there seem to be, I suppose, a bit of kind of, I don't know what would be the right word to put it now. We just say controversy over where a lot of groups were in the one area and they were overlapping with each other. Yeah. And there was talks then of polygoning and having like honeycombs as opposed to circles, right? And yes, at the time, it all seemed very plausible, and you know, we'll start looking at it, and I remember sitting down with a few groups and drawing maps, and we were agreeing areas and all of that, and that's fine. But I suppose on reflection and thinking about it further, is it any harm to have groups overlapping with radiuses?
No.
Because at the end of the day, it doesn't matter whose area it is, as long as somebody gets to the call. And I suppose, like in terms of the fire service, for example, especially in the rural areas, if there's a road traffic accident anywhere in the county, now I could be corrected on this one, but I know in Cork, right? They send a fire appliance from one town and they send another one from another, so that they can be sure that one of them will get there. You know, same if someone's trapped in a house fire, that kind of thing. So it's the same for us.
Yeah. Like,
does it really matter what colour T-shirt you have or what your group's name is when there's somebody on the ground and if someone needs help? So from now on, if groups overlap, so be it. At least we know then we might even have two lots of responders going, which I know it can contradict some of the thinking now as well of having too many people at scene. But there's no issue with when you arrive and see if there's two people in there, which is a chat we have anyway before a group goes live. So for groups who aren't live or anywhere near it, this is a chat that we do have. We have a bit of an operational chat beforehand anyway. But like if there's two members in there already doing CPR, by all means pop your head in and say you're there, but come back out of the house. The days of 3 or 4 in the house are gone. You know, they are. So it's just, unfortunately, from the community aspect of it, the kind of the really human aspect of it, of the making the cup of tea, you know, holding the hand of the patient's relative. Unfortunately, it's all gone as a CFR. The job now is to get there safely, don your PPE, go in and treat what you find, and back out, doff your PPE, and make sure you're safe going home to your family.
Yeah, but we always said we overlap slightly with Lessington and Dunard, and our mantra was, It's not Dunard CF Carrick arrest. It's not a Blessing CF Carrick arrest. It's not a Dunlavin Carrick arrest. It's just a Carrick arrest. Yeah. And when we arrive, we just do what you said there. Pop the head in. Need any help? Okay, we're going. And that's the way we've operated for years. And it's a patient focused. You're there in the community. It's patient focused. It's not about whose cardiac arrest it is. It's about the patient.
Yeah.
You know?
Yeah. It's the same. It's the exact same for frontline ambulance crews. It doesn't matter if the cardiac arrest is in a particular village. It's whatever the nearest resources are that are sent.
Yeah.
For that person on the ground, that's all that matters. So parochial and GAA and all these parish boundaries that have been causing problems for years will be no more.
Yeah. I thought you were going to say Dunlavin there for a second there, but anyway. Okay. Seriously, just moving on again. I have a question now from Essling CFRs. They're up in Leitrim, I think. Are they in Leitrim? If people don and doff PPE incorrectly and feel they could be exposed to COVID, obviously, should they go for a test?
If someone is worried.
Sorry, beg your pardon. I said it incorrectly. If people don and doff PPE incorrectly and feel they might be exposed, should they go for a test?
Okay, so it's pretty much the same if the PPE becomes damaged while you're at the call, and what you would deem to be donning incorrectly as well. But the only advice I can give now on this, because this video when it goes out could be seen in 3 months' time, or it could be, and things could have changed again. So I would say consult the HSE guidelines for what it is at that time. But in general, it's a case of, to keep an eye on yourself and make sure that you really sanitize everything properly, your hands, your arms, any exposed areas. But in terms of the test, I would just follow the guidelines and ring the helpline even and explain what happened and leave them guide you, because things change so much. It would be wrong for me to recommend something now that might be different in a week's time.
Okay. Well, this is another one for me. Is there are there positions available on the CFR Ireland committee other than reps? Well, actually, the short answer is yes, there are. Under our constitution, when we set up our organisation, firstly back in 2015, we went to charity regulator to register, and they came back to us and said and recommended that we convert to what's called a CLG, which is a company limited by guarantee, which would be more suitable for the organisational structure that we were envisaging at that time. So we went along with that. Now it was a long process, but basically we are a company now. What that means is all our activities are out in the open. There's no place for us to hide. Everything's up online there. You can go in and check the register. You can see our accounts, you can see our constitution, you can see everything about it. You can see our annual reports. All that information is there for you to view. But as directors and within the constitution, what we can do is, if we see a problem, it's one of the beauties about the way we've organised it is, if we see a problem or we see an area that we could do with some help, and we don't have the help within us, we can actually go outside the organisation and pinpoint somebody and say, for instance, somebody in IT, to come in and say, look, any chance you could do X for us, maybe project manage a job for us, do something like that. We have the ability to do that. And yes, so the short answer is yes. In fact, we have done it. We spotted a young lady some time ago, about 18 months ago now, a girl called Grania, and she was doing fabulous work up in North Kildare within her community and helping set up a group. So she came across our radar, and I phoned her one night and I was talking to her and said, it's a perspective we don't have within CFR Ireland. I didn't have at the time. I'm not that young. I've been doing this for a long while. So having a youth perspective, I thought might be a really good thing, because they're much more IT savvy and all that stuff going on, and much more social media savvy and all that sort of stuff going on. So I thought that perspective could be very, very useful. So I put it to the other directors. They agreed. So Grania is actually working on a project or two for us. It's actually pushing us a little bit to, outside what we would have normally considered. So it's a good thing. So Grania, so the short answer is yes, there are jobs for people other than reps outside of within the organisation. Now, our groups are going. Okay, here's another one for you, Ger. Are groups that are going live working differently regarding rosters, e.g., same two people going together, limited amount of responders responding to a call? We had something similar, I think, did we?
Yeah, look, again, I'll just touch on this one. Groups are operating differently, completely differently, and it comes back to the numbers that's seen. You know, and again, there's so many different dynamics out there, the different types of groups. Like my colleague Donald would have always said, you know, there's your big country town group, and you have your small country town group, you have your city group, you have all this stuff in play. So it really depends on where you are, what the response times are like in terms of NAS response. You know, that it's easy for us to turn around and say that there's only to be 2 members go to a call from now on. But that's no good if you're living somewhere so rural that you could be doing CPR for 20, 25 minutes or whatever the case may be. So we leave it up to the groups now, really, but I suppose four responders really would be enough. You know, and from my own experience of, you know, working in the ambulance service for, you know, I'm 16 years now, it was always the case that we only ever really had 4 at scene. It was always a 2 ambulance dispatch. And, you know, working in Cork for all of my time, we didn't have the CFR groups, you know, back in the early days of it all, you know. So we were really, it was just two crews, and we managed it, just the 2 crews. There is the whole different thing now with PP, obviously. And that's why we can't stress enough that people really train properly by wearing the PP and really, really spend a good length of time on the mannequin to make sure that they're able to operate in the PP. So with that in mind, like, you may need to rotate, you know, at a call. It's obviously highly recommended that you rotate your chest compressions, but you might also need to rotate the members in and out of the house, or wherever it happens to be. So things have changed. It's kind of a hard one to answer, because if I was to say there's only supposed to be 2 go to a call, and then those 2 people are under severe pressure, you know, while they're trying to manage the call on their own, you know, that's not fair either. You need support. So I would just ask people to be mindful as to how many people they're sending to a call. Right? We do not need the parking attendants. Okay, we don't need people out on the road. Granted, there's no problem going out to wave down the ambulance and all of that, but there has been issues in the past where there's been 10 or 12 people show up at a call, and that just simply, it's not safe now. And, you know, it was just a bit, I suppose, it did generate 1 or 2 complaints. It did.
Yeah. I suppose it's about communication as well, Jerry, isn't it? If you get 2 people on a call and they contact the NEOC when they arrive to confirm what they're seeing is what was transferred over, and during that conversation they get an ETA of X minutes, 20 minutes, 30 minutes to say, okay, might be a good idea to get a second pair of hands or a third pair of hands in here at that stage. It's about communication, isn't it, though? We can do that, can't we?
Yeah, absolutely. Yeah, nothing has changed in terms of communication. The only thing that has changed in terms of communication back to NEOC is that it will be a complete requirement for every group now to text back. There will be no exceptions. You know, so like that's something that all the members of the groups are going to have to get used to. It's not that hard. It's a couple of digits, you know, and press send. But it is something that, like, we need to know you're going, and that's it. Bottom line. And likewise, then,
sorry, could I expand that? You need to know they're going, but you also need to be able to stop them from going as well. And that's exactly important. If you don't know they're going, you can't stop them. Yeah.
Exactly. And that's it. It's safety. You know, statistics come completely last way down the bottom of the line somewhere. And while they're important, they're not as important as anyone's safety. So people must text back. But you're right, communication back to NEOC is definitely the most important thing. And just again, where that has changed is your phone. You just need to be mindful of your personal belongings now in a call, in terms of contamination. And, you know, like you might forget, so you might use your phone while you're at the scene, put it into your pocket and say, I'll clean that now afterwards.
Yeah.
Between one thing and another, you don't. So you go home and you have your hand, you know, you take the phone out and you're after touching the phone again. Or, you know, most, like a lot of houses would have an 8-year-old now or a 10-year-old looking for loan of the phone to make an old TikTok or do a Jerusalem dance, or, you know, like, and now it's being passed along through the family as well.
Yeah, yeah.
Like, you know, just simple things like putting it into an aqua pack, or, you know, the likes of even a good strong zip seal bag. You can still operate the phone through it. Just make sure that you can, and then, you know, it's just there's a lot of things that need to be thought about.
Yeah, absolutely. Okay, here's another one now. What should responders do with their shoes when they come home from a call?
Okay, well, I'd be recommending that responders deal with their shoes before they ever leave the scene, and not to wait till they get home, because again, we're trying to limit you bringing anything home with you. So the best thing for that is to have a bottle of some sort of spray disinfectant that won't damage your shoes, but will tackle the COVID, or is it, as they said, 99.999% of germs. So that's one option. You can do that coupled with having a spare set of shoes in the boot of the car, and just taking off the ones you wore to call and putting them into a bag and sealing it and leaving them there for over 72 hours, and they would be deemed to be safe as well, even if you were never to spray them. So they're the kind of things that people need to start thinking about outside the box. Yeah. And it's, like, you know, it's a bit like the phone. Some groups have come back to say that they've been buying tracksuits in a well-known department store at a knockdown price, and but they've been basically like they've had this. They're trying weird possible to have the tracksuit pants available at home to put on if it's night time or whatever, and or just have spare clothes in the car that you can change if you really want to. But I mean, the HBSC are telling us that the gown, goggles, gloves, mask, face shield, that's the level of protection we need. So, you know, unless that changes, that's exactly what we will be doing as an ambulance service, following those guidelines.
Okay. Okay, but question now from Kerry CFR Group. We currently have a significant number of volunteers and people who wish to join as volunteers. This can be a very costly process of training and maintaining CFRs, brackets, equipment, certification, vetting, etc. Do CFR Ireland or NAS have any advice on recruiting volunteers? Do you want to go first, or will I go first?
No, I'll leave you have that one.
Yeah, I see. If you have volunteers, you're doing really well. But the process of recruiting volunteers, we found over the years, is you have to get out there. You go to local fairs and festivals and stuff, and you have your stand up and you have a go CPR. In the World CPR Day in October, you're out in your community doing this. You're just bringing your message into community, and that's how you generate it. Then of course there's social media as well. But back in the days before we social media, posters up in the village that you're recruiting at the moment, and a phone number if somebody would like to join or find out more information. Volunteer Ireland, your local chapter as well. If you register with those, they're a good source of volunteers. They'll send volunteers because people will be on their sites looking for opportunities to volunteer, so you can get contacted through those. So all of those things are ways of getting volunteers. You have to be out there. You have to work at every part of this. You have to work at as a group, and to get those new volunteers in, because people will go. People spend a few years with you, and then they want to leave off and do something else. Just one thing I always say over the years, Ger, about CFRs and community first responding, it's not like the GA or the local soccer club or local rugby club. There's no off season. So if you want to take a few months off, that means you're not responding, but the group stays responding. So there's no off season. So well, sometimes it might be the worst thing for your mental health, and just for your own sake, that you just take a step back and just do nothing for a while. And there should be room within your group to be able to do that, I think.
Yeah, so, absolutely.
That's the shoes there. Oh, here's another technical one, Ger. Have the National Ambulance Service developed a Responder app? If not, is there any plans to develop such an app?
Okay, so there was plans to develop one, and still remains plans to develop one. But like everything else, COVID has put everything on the back boiler. There was a number of meetings held specifically to manage the creation of this app or the procurement of the app. But to keep it short, no, at the moment there is no app in sight. It is an item on the agenda for the out-of-hospital cardiac arrest strategy, so we are looking at it from that side as well. But unfortunately, it's not as simple as people may think. There are certain procurement procedures that the HSE have to go through, and it's not as simple as load a well-known popular responder app. But we won't mention any brands, but look, it's not as simple as just contacting the manufacturer of an app and loading it onto our system and hope for the best. There's a lot of security and everything else that has to be worked out. So it's a long way off at the moment. It is a long way off. There's no point in saying that we'll have it in 6 months. It's, I'd be glad to eat my words on that one, but no, I can't see it anytime soon, to be honest.
Okay, the next one. Are there any plans or expected start date for the appointment of a new CEO in the South?
That's with our HR department at the moment. As you know, in the South especially, Donald Lonergan, huge loss to our team, massive gain to the education team. But he's been gone since November. I've been doing my best to try and cover it, but it's a big area, and then I'm doing my own job as well. But new engagement officer starting next week or the week after, and while she'll be coming in to split North Leinster, she'll be the number 2 CEO in North Leinster. For the time being, she has nicely offered to take on the South as well. So we will have a dedicated.
Hit the ground running then.
we will have a dedicated point of contact for the South within the coming weeks, but just not a permanent position there yet.
All right. Okay. Okay. Next question. Will the National Ambulance Service mandate charity status for CFR groups in line with legislation?
No. No is the simple answer on that one. It's not part of our agenda at all. We don't require it at present, so it's not something that we as an organisation are looking anything towards. Now, I do know, John, that your organisation is a very strong advocate for it. So I suppose, by all means, you can take over from here as to why it might be a good idea for people to register. But certainly from an ambulance perspective, it's not a requirement at the moment.
I actually can, yeah. It's very, very simple, really. A few years ago, not too many years ago now, I'll put this as mildly as I can. There was one or two very, very bold charity organisations which some money went, and the funds, hard raised funds, disappeared, and they caused a lot of problems within the rest of the charity work that people were charity fundraising that a lot of other companies organisations were doing in Ireland. with that was the formation of the charter regulator, and they have asked that all community groups, anybody who involves themselves with the community, register with the charter regulator. Now, this is not charity status. Charity status is another thing. It's a different thing. This registering with the charter regulator. And when you do it, it actually opens up. We said this earlier on, or came to alluded to it earlier on. When you do that, that allows you to do fundraising for lots of areas like the HSE, lottery grants, your local county councils. It's just they ask you for that number, and basically what it does for you in the community, it says that you are an upstanding, organised, legitimate organisation in the community, registered with the local with the Irish charter regulator, and that's what you need to do. And it is for any group involved with the community. It doesn't actually matter about whether you fundraise or not. That's actually irrelevant. But if you involve yourself with the community, you should register with the charter regulator. It is a bit of a process, but it's an online process, and they're extremely helpful. The charter regulators are really helpful. You'll get a lot of help along the way, and then we've got help and documents that can help you out with the process as well. And you don't have to do it in a week or 2 weeks. You can do it over 3 or 4 months. You can just spread it out and upload the documents as they become available. And it really solidifies yourself within the community. It makes you create an organisation that's sustainable in the community as well, because a lot of these CFR groups, where there was nothing before, you're starting from scratch and you're building this organisation. So you have to have all your P's and Q's and I's dotted and everything else done. So it's a good idea. I believe it's a good idea. And I just checked there recently, Ger, because I saw the question coming up. There are 32 groups currently registered, 32 CFR groups currently registered across the country, and that's 11.5 to 12% of groups are already registered with the charter regulator. So that's a great start, brilliant start. It's a bit late now because we were a year into lockdown, but it could have been a great exercise for CFR groups to do during lockdown. It's a bit late now to suggest it, but anyway. Okay, here's another one for you, Ger. With increased staff in the CFR section of the National Ambulance Service, are there any plans to unify community first responder groups in Ireland to a national organisation? Example, the Civil Defence or the Irish Coast Guard?
Okay. I just tried to make sense of that.
Well, I already know the Civil Defence, a lot of them are CFRs, and some of them respond, and certainly Coast Guard units also respond as CFRs, don't they, as well? Some of the organisations, don't they?
Some of the members would, yeah. Okay, so I suppose just the increased staff.
Okay.
Okay, so I'm not being funny. Okay, but at the minute, the increased staff in the community engagement side of things, I mentioned it earlier, but just in case it was missed, basically we have the community engagement office with a community engagement manager and 2 current community engagement officers with a third incumbent, and that's the community engagement team. Obviously, when the south position is filled, that will add another, so we'll have a team of 5. Now, you take any big Garda station, and they could have anything up to 6 or 8 community Gardas just for that station. So I suppose in terms of our staff, no, we're very light on the ground. But if it's meant that by staff you meant the numbers of volunteers, so that there's, over 3,000 or was, prior to COVID, then I can see the point completely. And I did ask the question through HR, just, in terms of something like that. And I was basically, I was told that you would actually need an actual HR department to run it. To run, like, you're talking over 3,000 staff numbers, if you look at it that way. So no, at the minute, CFR groups, and I think this just reiterates, what we've said in a number of other questions to be answered earlier, is that there's probably a common misconception out there that CFR members are members of the ambulance service in a voluntary capacity, but they're not. It's not the case. And A CFR member is a member of their local CFR group, and they are linked to the National Ambulance Service. So it's not a case that our volunteer members have risen. It's that the community first responder volunteer network has gotten bigger. I would love to bring people in under the ambulance service as ambulance, directly under ambulance volunteers. But at the moment, that's a huge piece of work that is for later on down the road, and again, it's looking at the Garda Reserve model and looking at the Reserve Defence Force model. I can only imagine there's a lot of work behind the scenes there that's done to keep all that running. So with 5 of us for the country, it's not going to be something we can look at the moment,
Yeah. Okay, should we move on then? Just one for me, actually. How can I contact my local CFR Ireland regional rep? Well, there's the website. You can contact them through that, or if you drop an email to info@cfr.ie, we can pass on your details. It's as simple as that. Right. Here's another one. This one's for me. How do I become a member of the Red Army? Well, I have to say it's not easy. It's not easy at all, in fact. And I've just done some homework on this. And when we had our first Respond conference back in 2014, we had 32 people in the Red Army. Of that 32, 4 of us are on the committee, and 2 look after the safety statement and the risk assess the Respond conference for us. That's Linda Gilryan and John O'Reilly. And after that, then there's only 2 other members of the Red Army from that original one back in 2014. So there's not too many. So it does change a lot, and it changes year on year. It's not going to be easy for the next one because we've just had 5 new applicants, and that's our new reps. They're all going to be Red Army members, so there's a limited number of vacancies. But after that, how do you become a member of the Red Army? Well, basically you have to kind of shine out in your community, and you come up on radar, you come up on social media, or somebody will say to us, have you seen the work X has been doing? And we see it, and we see it. It's no coincidence that 4 of the Red Army of the current Red Army are Jeff King Award winners or recipients. So that's the sort of people that are on the Red Army. They tend to be coordinators. They tend to be doers, I suppose, if you want to use that phrase. That's the sort of people that they tend to be. And they don't necessarily have to be CFRs. We have a few people from the National Ambulance Service on it, helping us out. Joe Mooney comes to mind. And that's the sort of people that are on it. We have Claire Ahern from Swords CFR, so she's also a paediatric nurse, and she helps out as well. We bring in people with expertise as well that can help us out with IT or admin support or something like that. So we've all of these different things that we consider when we're bringing people into the Red Army. That's how you become a member of the Red Army. That was all, Jared. That was all the questions we got in when we went looking for questions through our social media. But there's another one that has come up recently, and it comes up every now and again with community first responders, and that is how do community first responders handle a DNR, or what's called a do not resuscitate instruction, I suppose, when they arrive on scene? How should they handle that? Okay,
yeah, that has actually come up a lot, actually, John. A few have said it to me. And I suppose, look, it is a difficult one because it's a sensitive one as well, where you're I suppose you're there to do a job. The reason you're there is because somebody in the house called you to be there. Is probably the first point. There is no CPG there to cover CFR in the handling of a DNR. And I know from my experience working on the frontline ambulances, it's something that you always have to be so careful of. There's just so many things come into play with it. So the way I would advise CFR members to handle this is to explain to people when they arrive on the scene that we're here because somebody rang 999 for us to help. Now, it is our job to help, and that, you know, we will go in and we will do what we need to do, and that the ambulance crew, who will be following shortly behind, will be able to speak to you about the DNR. You know, you obviously can't barge past somebody, so I would again say that you have to handle it extremely delicately. You know, the ambulance service, it's a coiled spring. Someone rang 999, cardiac arrest, 9 echo 1, the spring is launched. It's very hard to put the toothpaste back in the tube after that. Everything is on the way at this stage. So it is just, I suppose, to be mindful of the upset in the house, the shock. We do find in some cases where somebody might come out mid-resus attempt and now say that actually there's a DNR, you know, and they panicked and whatnot. You know, again, leave the ambulance crews handle that, and just be very, very respectful in the manner which I know everybody would be, in the manner in which we kind of say that you know, that it's our job to do everything we can to resuscitate the person. You know, and you just have to, it's case by case. And I know it's trying to, I'm not trying to fob it off by saying it's case by case, but just in my experience, there's so many different things come into play in families when it comes to DNRs, and trying to, you know, it needs to be current, you know, in a recent period of time, and there's a lot of stuff in it. So yeah, from a CFR perspective, I would be saying, unless you're physically prevented, and you know, if the family are absolutely stern that you are not resuscitating their loved one, well, you have to respect their wishes. You've done everything reasonably possible. So you've responded to the call with good intent, you've entered the premises with good intent, and you attempted to resuscitate the patient with good intent. And there's nobody can ever say anything about that to you, that, you know, that you should have done more, as long as you've handled the family appropriately, you know, and with good care and respect.
Yeah, it is a tough one, all right, because people, you know, ring when there's a collapse, and when they have a few moments to think they might come back. But it's a strange one. It's a tough one. It's a tough one, and I suppose another good, when it comes up, if you happen to be on scene, I'm not saying it's a regular thing, but it comes up regularly in conversations. First thing you should do is contact ambulance control, I suppose. That's the first thing you should do.
Yeah, and that comes back again to sending the text message to say you're going. Yeah. Because what often happens, and you hit the nail on the head there, John, is that the call might come in as a collapse. It may come in as a seizure. You know, there's so many different things that could come in as, you know, and as the call is progressing, as we all know, the text message that you receive is completely automated. The minute the parameters are hit for that text message, based on your geolocation and the category of call, you're getting the text. There's nothing can stop that, right? And what can happen is that as the call progresses and now they figure out the patient isn't breathing, well, it now becomes a cardiac arrest on the system. And like the next conversation that the call taker might have is where they're telling there's actually a DNR, but it's too late because the text has gone. And by you sending your mobilization text back, at least the call taker can look at it and they'll see that you're going. And if it's a case that it's a definite call that's not for resus, then at least they can stand you down. And where this can happen is what we have now as well out there is an ambulance care directive, and it's a joint initiative between the ambulance service and the DFB, and obviously the HSE as a whole, and basically it's for children. It's for anybody under the age of 18, and it's a legal document. A copy of it is held at all times with the person, and a copy of it is actually held in the control rooms, both I'd imagine the DFB and certainly here upstairs in NEOC. So when a call comes in for a cardiac arrest, we have this on file already. Okay, so, but, and I'm going to share it just so people know what it looks like, because it's unmistakable in its design, basically, with the logos on it and the classic ambulance checker around it. So I'm just going to share the screen, and John, you can confirm that it has come up for me, because I don't know when it comes up.
Yes, it's up here. Yeah, I'm looking at it.
Okay, so this is in circulation now across the country, and despite all of the various documentation fields in it, and it's signed off specifically with families and with the doctors and consultants and all of this, but one line that stands out in all of it is where it says, and it's just above the big box at the very bottom, a parent or legal guardian can withdraw an end-of-life request at any time by telling the ambulance crew. So this is something that may also be there, and it could be a case that it's presented at the time to say that somebody's not for resus, and what I'd be saying with this one is certainly get back to NEOC about it. Okay, it may not flag up for them if the incident happens away from the person's address, or I'm not 100% how the system works in NEOC for this, but it is something that, despite how legally binding it is, the guardian or parent can there and then just say, no, I want the person resuscitated. So that's just to give a little taste, I suppose, or an idea of what kind of stuff is out there, and how it can still be changed by a parent or guardian saying they want to, they still want the person resuscitated despite all of this documentation, you know. So it's a really hard one for a CFR member to have to try and carry. So again, you're there to help, and you're respectfully requesting access to the patient to help the patient. And again, if the family or the people there are saying absolutely not, or you're not going to, well then you have done absolutely everything you can to help that person. So. Right.
Probably something that should come up in operational discussion before they go live with new recruits, or maybe even in training. It's something instructors should discuss with at a training night, how to handle it, how it should be handled, and a bit of direction from yourselves, just like this, would be very, very useful. Yeah. I think, because it's just one of those things. It's not black and white. Just you say it's not black and white. There's just
so many things can change during it, you know. And I have been at resources, as I said, where the DNR is produced midway through, and there could be reasons for that too, because the DNR could be in place because the person, let's say, may have a terminal illness, and they may have been given X amount of months to live, but the reason we're there is because they choked, or something completely separate to what the DNR was put in place for. And that's why you could have a family member then saying, well, actually, they're not in cardiac arrest, or they're not, in the condition that they're in because of their medical history or condition. It's because we were sitting eating steak and the person choked. So, that's why there's so many variables there, so just certainly our volunteers should not be worrying about it. They're there because we sent them, and you're there to do your best. And if you're prevented from doing that by somebody at the scene, then you've done everything that you possibly can.
Yeah. Okay, that's all the questions I have for you.
One question that I'm asked quite regularly when I mention CFR Ireland There is sometimes a mix-up, as you well know, where we get emails that you should get and you get emails that we should get. They think that Ambulance Service and CFR Ireland are the one entity. We're not, obviously, but we are working for the same common goal, and we do work quite closely. But it's just that there is that difference. So I suppose we know what the ambulance service do in terms of CFR. We provide the cover, we give out the text messages, we link you in, and we do all of that. But I think it would be beneficial just for you to tell us, for people who don't know, what exactly does CFR do for them, CFR Ireland do for them.
All right. Yeah. Well, firstly, just if a community comes forward, like we have one or two here today, come forward and say, look, we want to set up a group, you have to contact the ambulance service, because you have to adhere to the last community first responder policy. And there's no kind of half buy-in or quarter buy-in. You have to buy into the whole lot. However, to set up a good sustainable group, you have to organize yourself within the community. And what we can do, we can help, because we have a lot of experience doing this now for about, I think it's 16 years next month. And what we do is bring that experience into a group to help them not make some mistakes or delays in that whole process. You have to, for instance, you should register with the charity regulator, but you don't have to do that straight away. You can do that later down the process. You might have to do some fundraising. We can direct you what's good and what works and what's easy and what doesn't, and even with some local groups, what's available locally, what funding is available locally. We can help you with recruiting, what worked for us, what doesn't work, what we found was easy, how to get yourself out in the community. What's your next step after you become a group? What you could do next to build resilience in your community, because it's not all about the community first responders. I believe, it's my belief that cardiac arrest survival will actually have to happen at home. So we have to start teaching everybody CPR, and community first responder groups are ideally placed to do that, because they live and work in the communities and they're very, very flexible in what they do. Another thing that we're very, very flexible. We can change tact, because we're not a government agency. We can do different things at different times. We also represent CFR volunteers on a couple of panels. For instance, we have a representative. We were invited by the director of the National Ambulance Service to represent CFRs on the out of hospital cardiac arrest survival strategy group committee. We're on that group. We also run the HICRA HTA HTA assessment about a few years ago, when they were looking at defibrillators in businesses around the country. We just represent a CFR community first responder volunteer view on those organizations. That's what we do. We network groups around to make them stronger, so they can work together. Instead of maybe having a one person at a big event locally, you could bring in one group, rather you could bring in 3 or 4 groups. So we network you guys. Look, there's a big event coming out locally. Why don't you all group together? For instance, we also have a seat on the Restart the Heart committee. That's on October 16th each year. Now, we didn't have one last year. We might be able to have one this year, and we help coordinate in conjunction with yourselves, in fact, community awareness and teaching CPR in the community. And we actually help out in some of the HSE sites, as well as doing the usual supermarkets and local community halls, and do all of that as well. So that's the sort of thing we do, and basically encourage people to spread the message of knowing CPR, knowing the signs of cardiac arrest, knowing the signs of chest pain, what to do in those events, that you should ring 999 and 112, all that sort of thing. We keep on driving that all the time in the community, and asking our community groups to do the same. And we help them with resources to do that as well, by sending little videos or instructions on how to do that, because that's really what we do. It's basically the volunteer side of the community first responder. It's not the National Ambulance Service bit. It's the non-medical bit, I suppose.
Yeah, no, thanks for that. Yeah, absolutely. Yeah. No, that's great. Thanks, John. As I said, it is a common question as to what's the difference in who does what and things like that. But again, we do everything to, as one as such, to help our groups get up and running. And as you rightly said, Restart the Heart is another thing that the community engagement officers would be deeply involved with. as well as yourselves and other agencies, and hopefully we will have it again this year. And finally, just to say that, again, 100% there with that the cardiac arrest is a community problem. Yes, it's our job, but it's your member of the community that's not at mass, when mass is back, the following week kind of thing. And certainly hands on chest, it's gone over 80% now at this stage for bystander CPR. There's been one or two recently that I've been directly involved with and at scene for, and they have wholeheartedly said they didn't know what to do. They held their hands up, they didn't know what to do, but that the call taker up in Neoch brought them through exactly what to do. And thankfully the outcome was a ROSC in this situation, but it was a pre-hospital witness cardiac arrest, immediate chest compressions, and very, very prompt defibrillation. But again, community level, and that's where the lives are going to be saved.
Yeah, it's just getting people not to be afraid to initiate the chain of survival. And yes, they can get directions to do CPR over the phone, but if they've done it before, even in a 5 or 10 minute tutorial, their confidence level goes much, much higher, and they know what to do. They're not kind of saying, well, what do I do next? They actually know. So it's a brilliant thing. There's another little event that I neglected to mention, Ger, that CFR Ireland organised, and that's the Respond conference. We've just had our second virtual one. Never thought I'd have a virtual conference. Didn't know anything about it this time last year. And we actually would have cancelled our last year's event just about this week. And so hopefully back in 2022, we'll have a live Respond conference. We are planning one for September, but we're waiting and seeing what's going to happen with vaccinations and COVID in the community and all of that. So we actually have to take stock during the summer and see if it's safe to hold one. But the Respond conference is a conference for anybody interested in out of hospital cardiac survival. Everybody from all walks of life, and from CFR groups to non-CFR groups, just individuals, are all welcome at it. And there's loads of information, loads of teaching, loads of workshops. We have international speakers, we have Irish speakers, we have local experts. We in Ireland now are becoming experts at this. We're actually getting very, very good at it, as you know, Ger. And we're not looking abroad for the expertise so much anymore, because we're pretty good at it ourselves, and we have a plan coming in place now when the strategies committee gets up and running again. And it's the future, I think, is very, very bright, and I'm really looking forward to it. It's very exciting, I think. Have you any more questions for me, Ger? I'll put my hat back on.
No. I suppose just while you're going up there, if you remember, we did throw it out there to the public the last time as to how many times you mentioned Dunlavin during one of our video takes for the last virtual Respond. So did we get a winner for the CFR Ireland Cup on that one?
We did, Ger. We did get a winner, and we did. And will I announce it now, or will I'll announce it? I might as well announce it now. It's actually Pauline Nolan from Connery CFRs.
Right.
She counted out, and I didn't do the recount, but she said it was some astronomical figure, like 17 times. But I don't know if that's true. Yeah.
And my ears were ringing Dunlavin going home, so I would have said a lot more than 17. But no, fair play. And
did I mention the Arts Festival?
No, John.
Well, we have a fabulous arts festival and a brilliant dog show at it, Ger. And
excellent.
If you're in the area during the summer and having one that's on, you should come. Definitely, you should come.
I'll be there. I'll be there.
Listen, Ger, in all seriousness, thank you very, very much for your time. I know we've gone on a little bit, but these are relevant questions, and a lot of people are asking them, and it's important as well. So I really, really appreciate it. And I really appreciate yourself and all the other CEOs, all the work they're doing trying to get groups back up and live. Stand them back up, I think is what Martin Dunn said, standing them back up.
Standing back up, yeah. So look, again, thanks everybody, and I suppose for people who are watching it, it's most likely going to be our members from the various groups around the country. And just to say that I know I did say the community engagement team is quite small in its numbers, but we are working very strongly, for all of you and to get you all back up and running, as I said, safely, and hopefully then begin to expand the community first responder network again. So thanks for everything. Thanks for your patience. And I know it's a slogan that's well used now, especially since COVID started, and that's what we will get there. And we're proving it, and our RASC number already is testament to the good work that you're all doing. So I look forward to seeing it grow, and likewise work with yourselves, John. So thanks for everything.
Listen, thank you, Jaron. Thanks for your time. Happy St. Patrick's Day.
Many happy returns. Thanks, John. All the best.